Welcome to the Deep Dive. Today, we're digging into a really interesting study. It asks this, well, pretty big question. Could social media actually be a serious tool for public health? We're looking specifically at how something like Facebook might, be a bit of a game changer for HPV vaccination, especially in communities that often face health disparities.
Yeah, it's a critical area.
So our mission today is really to unpack this specific Facebook intervention, see how it affected young Black adults, what worked, what maybe didn't, and what we can learn going forward.
Absolutely. And HPV vaccination is so important. It's primary prevention against a whole range of HPV-related diseases, really crucial for long-term health.
Right.
But, even though the vaccine's been around, uptake isn't really where we need it to be. If you look at adults aged 18 to 26, only about, 21.5% have gotten the recommended doses?
Not that low.
Yeah. And it's a particular concern for young Black adults. They're definitely a priority population for improving those vaccination rates.
Okay, let's unpack these numbers a bit because they really stood out to me. You look at Black female participants, 18 to 26, their completion rate is 44.7%, which is, noticeably lower than the 57.9% for white female participants in that same age group.
Right. Quite a gap there.
And then for Black male participants, same age range, it's 29.4%. Now, that's actually a bit higher than white male participants at 26.6%, but still, overall, pretty low numbers, wouldn't you say?
Definitely low overall. And considering the vaccine is recommended up to age 26 for catch-up?
Well, it just highlights the need for these targeted efforts, doesn't it?
Exactly. So what's holding things back? What are the barriers here?
Well, the source material points to a few key things. A big one is just a lack of awareness about HPV itself and about the vaccine.
Okay. Simple awareness.
Yeah, and it gets even more specific. They found that sub-Saharan African immigrants often have even less knowledge compared to both white and Black American-born folks.
Interesting nuance. And this lack of info, it naturally leads to misconceptions. People might think the vaccine isn't necessary for them. Maybe they don't see themselves as being at risk.
Right. It won't happen to me, sort of thinking.
Exactly. Then you've got practical things, like concerns about the cost of the vaccine series, worries about safety, side effects.
The usual vaccine concerns, yeah.
And system-level barriers, too, of course. Limited access, maybe documentation issues. Sometimes providers just aren't strongly recommending it.
Okay.
But crucially, and we really can't overlook this, there's the deep-seated issue of historical mistrust. Unethical research in the past, sadly, has contributed to lower vaccine uptake and just general medical mistrust within the African American community.
That is such a critical point. It's not just about handing out pamphlets, is it? That history matters.
It absolutely matters. It shares everything.
So faced with all these challenges, here's where it gets really interesting. This study tried something pretty innovative, using social media, specifically Facebook. And the choice makes sense, right? I mean, the stats are compelling. 73% of Black adults use it.
Yeah.
And young adults, 18 to 24, spend about 11 minutes a day on there.
Yeah, they're meeting people where they are.
Exactly. And what really makes this study stand out, I think, is that specific focus on young Black adults. It seems like other Facebook interventions haven't always targeted this group so directly, despite the clear need.
Right. And this approach wasn't just thrown together. It actually has a theoretical backbone. It's based on something called the theory of planned behavior.
Okay, sounds academic. Break that down for us.
Sure. It's a pretty established idea in psychology. Basically, it says that your intention to do something is the single strongest predictor of whether you actually do it.
Ah, okay. So it's about influencing the plan to act.
Precisely. So the study aimed to nudge those intentions and the beliefs behind them to encourage getting vaccinated.
Got it. So tell us about the actual intervention. #HPV VaxTalks, right? What did that look like?
Yeah, so it was a pilot study, just one group, and they measured things before and after the intervention.
Pre and post test, okay.
Exactly. Involved 43 young Black adults mix of African American and sub-Saharan African immigrants in a southeastern state. And the core was this 8-week program on Facebook called #HPV VaxTalks.
8 weeks on Facebook?
Yeah. They put out about 40 posts altogether, maybe 4 or 5 messages a week. And this is key. It was all inside a secret and closed Facebook group.
Ah, so private.
Very private. The idea was to make it a safe space, encourage people to actually talk openly without feeling watched.
That makes a lot of sense. And the content itself.
Well, this is another crucial piece. It wasn't just generic health advice. It was designed to be culturally appropriate.
How did they manage that?
They worked really closely with a youth community advisory committee. These young people gave input on, well, everything. What topics to cover, what kind of posts they preferred, was it easy to use, did it feel relevant, culturally on point.
So co-created, essentially.
Very much so. And the content reflected that. It was diverse, relevant images, cool graphics, even memes, short bits of text, links to trusted sources like the American Cancer Society, the CDC, trying to keep it varied and credible.
Okay, memes and health info, I like it.
Yeah.
So the million-dollar question, did it actually work? What did the numbers show?
Yeah, let's get to the results, and they are pretty compelling. So remember those 23 participants who hadn't had the vaccine when the study started?
Uh-huh.
Well, at the follow-up, 7 of them, that's 30%, reported getting at least one dose.
30%. That actually sounds pretty significant for an 8-week online thing.
It is noteworthy, yeah. Think about it. Nearly a third of the unvaccinated group took that first step. That suggests it did more than just raise awareness. It actually prompted action.
Okay, what else changed?
Knowledge saw big jumps. Average scores for general HPV knowledge went from about 7.3 up to 11.1.
Wow, quite an increase.
And knowledge specifically about the HPV vaccine also improved significantly, from an average of 2.8 to 4.7.
So people definitely learned things.
They did. And importantly, vaccine hesitancy went down. The scores actually increased from 28.3 to 29.9, and on this scale, a higher score means less hesitancy.
Okay. So less unsureness, less reluctance about the vaccine. That's a key outcome.
A very key outcome.
But it wasn't all significant changes, right?
That's right. It's important to be balanced here. The study didn't find statistically significant changes in how severe participants perceived HPV to be, or in the perceived benefits of vaccination, or things like self-efficacy, like their confidence in their ability to get vaccinated, or even their stated intention to vaccinate.
Any ideas why those didn't shift as much?
Well, the researchers offered a couple of potential reasons. One is just the small sample size. It's a pilot study, remember?
Right.
And it's also possible that the baseline scores for some of those things were already relatively high in this particular group, so there just wasn't as much room for significant improvement to be detected statistically.
Okay, that makes sense. Pilot study limitations. Now, let's flip to the other side. What did the participants think of it? The qualitative stuff.
Yeah, and this is really positive. Participants reported really high satisfaction overall. Usability scored an average of 24.8 out of 30.
Pretty good.
Acceptability was 20 out of 25, and relevance was 20.1 out of 25. So strong scores across the board, suggesting it landed well, it felt right to them.
It sounds like they found it genuinely useful and, well, liked it, which is maybe half the battle with health intervention sometimes.
Absolutely. And the direct feedback, the quotes from interviews, and the open-ended questions, they really add color to those numbers.
Yeah, what do people say?
Well, they express strong appreciation for the visual content. Someone literally said, the use of memes and graphics made the information clear and easy to understand.
Memes for public health.
Right. Another person noted, visuals really caught my attention. And crucially, people said the intervention significantly influenced their decision to vaccinate against HPV.
So connecting the dots back to that 30% uptake number.
Exactly. You had quotes like, after learning more from the intervention, I decided to get vaccinated. And the intervention gave me the information I needed to make an informed decision. That's powerful feedback.
That really is, turning likes and shares into actual health decisions.
Mm-hmm.
But it wasn't perfect, presumably. Did they have suggestions?
They did, yeah. Some participants wanted more interaction, more engagement within the group, which makes sense for social media, right? You want that community feel.
Definitely.
They also suggested maybe branching out beyond just Facebook, thinking about text messages, SMS, maybe WhatsApp.
Meeting people on other platforms they use.
And interestingly, a few suggested maybe a shorter duration could work too, perhaps like 4 weeks instead of 8. Keep it more focused, perhaps.
Interesting thoughts for future versions. Okay, so bringing this all together, what's the big takeaway from this deep dive?
Well, I think
it feels like there's real potential here, doesn't it? This study, #HPVVaxTalks, it really does seem to show that these kinds of social media interventions can make a difference. Increasing knowledge, reducing hesitancy among young Black adults specifically.
I agree. It strongly suggests that culturally tailored, community-involved approaches using social media can be effective tools for health promotion, especially for populations that might be harder to reach through traditional methods.
Yeah.
Now, we should also acknowledge the study's strengths and weaknesses, like any research.
Good point.
Strengths are definitely the theory-driven design, that collaboration with the Youth Advisory Board that's huge, and using mixed methods, getting both the numbers and the stories.
Right.
Limitations, as we touched on, include the small sample size, which impacts generalizability. We can't say this would work exactly the same everywhere for everyone. And the lack of a control group makes it a bit harder to say definitively that the intervention caused all the changes. Plus, relying on self-reported vaccination and behavior, there's always a chance of some bias there. And they did have some people drop out, which is known as attrition.
Okay. Standard limitations for this kind of initial study, but important to keep in mind.
Definitely.
So, thinking about the positive impact, especially on knowledge and hesitancy, and listening to what the participants themselves suggested, more platforms, more engagement, it leaves you with a question, doesn't it? How can future digital health efforts really build on this? How can we take these lessons, the cultural tailoring, the visuals, the community input, and maybe create even more dynamic, more engaging ways to boost vaccine uptake across all sorts of diverse communities? That's something for you, our listener, to think about.